Dengue cases likely to increase with the coming monsoon. Senior consultant physician Dr. Anand Vijay Vikrama warned that with the upcoming monsoon season, there's a risk of dengue cases increasing rapidly, and he urged that dengue control needs to receive more attention from all sectors. During an interview conducted by the President's Media Division recently, Dr. Vijay Vikrama emphasized that everyone's assistance is important for this because neither the government nor the health authorities can control the dengue virus on their own. There has been a clear increase in the number of dengue cases this year, and over 47,000 cases have been reported since January. The majority of the patients recorded thus far are from the Colombo and Gampa districts, and the health and security officers were forced to work together to launch a special initiative to clean up the garbage in those areas, he said. Dr. Vijay Vikrama said 75% of the reported cases involve those who are older than 15 years of age. Nowadays, young people are more likely to attract the disease than small children, despite the fact that it is used to spread among them more frequently. Dengue is a virus. As a result, there's a strong likelihood that dengue can be easily transmitted via mosquitoes from one infected person to another, he said. Eliminating mosquito breeding places is vital. The dengue mosquito typically exists in areas where clean water gathers, anywhere including waste plastic, used tires, flower pots, coconut, and king coconut shells, serves as a breeding ground for dengue mosquitoes. Such areas should receive as much attention as possible and should be removed immediately. In addition, precautions should be taken to avoid mosquito bites, he pointed out. Furthermore, it is important to take precautions against mosquito bites in order to avoid spreading the virus to others. For that, the body should be covered with clothing. Additionally, there are mosquito repellents. It can also control mosquito bites, but none of these approaches is completely effective. Forces have all stepped in to help control the disease by destroying mosquito breeding grounds. Special programs are being implemented focusing on the provinces where dengue is spreading most. Within the coming week, a special initiative will begin with a focus on Colombo and Gampa districts, where the majority of cases were reported. There will be a cleanup of garbage in such areas. It has been also agreed to provide the labor contribution of the army for this purpose, he said. Even if water is removed from containers, mosquitoes' larvae can remain. Therefore, they should be cleaned thoroughly and water should not be allowed to collect again. The typical lifespan of a mosquito is 5 to 6 days. Therefore, weekly cleaning of the surrounding is crucial. Keeping your surroundings clean is also a must. Controlling dengue cannot be done by one person alone, and it cannot be done only by a few institutions. This requires the support of everyone in the country. Moreover, a person suffering from dengue should not work hard and rest is essential. If not, the chances of complications are high. Any patient with a fever should only be given paracetamol. It has also been advised paracetamol may occasionally fail to entirely bring down the fever. However, patients should not be afraid in such cases. Having a fever does not escalate to a major issue. Complications can also be minimized through physical rest. Meanwhile, it is also vital that fluid intakes are given to patients to keep them hydrated. King coconut water, orange, lime juice, and Jeevani are generally recommended for this purpose, he advised the public.